Hello, my name is Yvonne Brooks from Veteran to Veteran Info LLC. I am a 100% disabled veteran, and I'm also an accredited claims agent with the Department of Veteran Affairs. I've served 20 years in the military, and I know how hard it is to get the benefits that you deserve. So with my accreditation and my intensive training, I know a lot of the VA inside information that most veterans don't know. And I'm here today to help you get the benefits that you deserve. The topic that we're going to talk about today is sleep apnea. Sleep apnea is one of the disabilities that a lot of people have a misunderstanding about. Sleep apnea falls under 38 CFR 4.97 diagnostic code 6847. The VA can rate you for sleep apnea from 100% to 0% depending on your symptoms. Most people will get 50% if you require the use of a breathing assistant such as a CPAP machine. But there's other sleeping devices that qualify that a lot of people don't know about. So some of the things that qualify as a breathing device is the APAP machine, the BiPAP machine, oral applications such as nasal stents and tongue retaining mouthpieces, implemented glottal nerve stimulation devices. They all qualify as breathing devices for the 50% disability. Then you can also receive disability for sleep apnea under the 30%, which there's no device required, but you're experiencing persistent chronic daytime sleepiness. Like you're at work, you can't stay awake, you're driving, you're always tired, you're nodding in and out. That's 30% level. Then there's the 0%. They will service connect you, but you won't receive a compensation for 0%. They just recognize that you do have a sleeping disorder. The condition is asymptomatic. It's not causing any symptoms, but it has a documented sleep order. In order to get sleep apnea, you will need a sleep study done. VA will not diagnose you with sleep apnea without a sleep study. But one of the biggest mistakes a lot of people make is saying that sleep apnea is PTSD causes your sleep apnea. When you have someone write a nexus letter, you have to make sure that they say that the PTSD aggravates your sleep apnea, or your sleep apnea aggravates your PTSD. That's the correct terminology, because a lot of people get sleep apnea nexus letters, and if it's not written correctly, you will not get your sleep apnea approved. And I've had a lot of clients that have gotten 50% for sleep apnea due to a correct nexus letter. And I believe that anyone that has PTSD, you need to get a sleep apnea test just to see if you have sleep apnea. And then if you do, then you can request a nexus letter from the psychologist or the sleep doctor to connect the dots to state that the sleep apnea aggravates your PTSD. That's one of the biggest things with your sleep apnea. And if the competent medical evidence of record shows the use of a qualifying breathing assistance device, it is medically required. The fact that the claimant is not actually using it is prescribed is not relevant. A lot of people think, well, if I have a CPAP machine and I'm not using it, that the VA is going to take away my 50% percentage. That is not true. The VA doesn't check on you to ensure that you're using your CPAP machine. Your doctor may ask you, are you using it? But the Veteran Affairs is not checking on you to make sure that you're using it in order to keep your 50% qualification for sleep apnea. And that's one of the biggest things. But there's a lot of things that you can also connect to sleep apnea. Let's say you have a service-connected condition for sinusitis. There's medical documentation and medical journals written that says that sinusitis can be secondary to PTSD. But in order to prove that, you will have to get the written journals and have a nexus letter from a qualified physician to connect the dots and say that your sinusitis Your sleep apnea aggravates your service-connected disability such as sinusitis. There's some other disabilities that you may have that you didn't know that you can connect sleep apnea to. Deviated nasal septum, even excessive weight gain. Even though obesity is not a qualifying disability, it could be a stepping stone to a disability. Let's say you have a back condition that due to your back condition, you're not able to exercise and you've gained weight. And now, because of the weight gain and the fact that you can't exercise, you now have sleep apnea. If you get a nexus letter from a doctor that states that due to your service-connected back condition, you've gained weight and now you have a secondary condition caused by your inactivity due to your service-connected back, is sleep apnea. And if they can connect the dots, the VA will give you your 50%, especially if you're using a CPAP machine for sleep apnea. Also, diabetes can be secondary. Congestive heart failure could be secondary. High blood pressure could be secondary. Parkinson's disease, asthma, stroke, lung disease, PTSD. There's numerous amounts of conditions that are secondary to PTSD that can, secondary to sleep apnea that you can claim. But the key is getting a nexus letter to ensure that you have the dots connected. And so if you have sleep, that's 50%. So if you have sleep apnea, please go get checked. Get a diagnosis from your doctor stating that you have sleep apnea. And then you can go forward and submit the claim to ensure that you get the disabilities that you deserve. So please stay tuned for more videos from me. Subscribe to my channel, hit the like, and I will help you get the benefits that you deserve. And God bless. Stay tuned.